During a health crisis, the town really looks to Denton County Department of Public Health, the Texas Department of State Health Services, and the Center of Disease Control and Prevention. We look to them for being the subject matter experts and also for the consistent message that they're providing, albeit fluid in this particular situation. The town issuing a disaster declaration allows us to enact our emergency operations plan. It also allows the opening of resources and funding from the state, and then it allows the mayor certain powers of limiting, in this case, limiting public gatherings and the amount of people that can be in a community space. During this situation, a typical day involves a lot of phone calls, a lot of emails, gathering information, getting updates on what's going on in the region and the state. I gather that information throughout the morning, especially as the Department of State Health Services and the CDC are updating their numbers and guidance documents. Then at 2 o'clock, there is an internal conference call with Public Safety and Town Manager's Office, and we discuss what has happened in the last 24 hours, as well as what we plan to do in the next 24 hours. Shortly after that time, I then issue a situation report to Town Council and executive staff, and then after that call, there is a state call that occurs every day, and it provides additional guidance of what's going on at the state and national level. And then in between all of those meetings, it's a lot of answering questions from internal resources, also some of our private public partners, and then sometimes having to seek out answers to questions from our partners in the region. The best sources for credible information right now are coming from the government entities. Unfortunately, there's a lot of rumors that are spreading rampantly on social media, but I encourage everyone to go to the town's COVID-19 webpage, the Texas Department of State Health Services website, or the CDC website. Additionally, Denton County Public Health has been very proactive on their website and social media platforms. To keep you and your family safe, make sure you're washing your hands regularly with soap. If that's not available, utilize hand sanitizer. Avoid touching your face, your mouth, your nose. Try to cough or sneeze into a tissue or into your arm. Make sure you're cleaning common touch surfaces. If you don't feel well, self-isolate and stay away from others. And then if you know of someone to be sick, make sure you're staying away from them. Currently in Flower Mound, if you call 911, our dispatchers are going to screen those calls if you are sick and not feeling well, and they're going to ask you questions if you are experiencing symptoms of COVID-19. If you are, that will change the way we respond to the level of personal protective equipment. So in addition to our normal gloves, we'll be wearing a gown, a face mask, and an N95 respirator. This is based on CDC guidance for EMS providers and what they should be wearing in the field when exposed to a known or potential COVID-19 patient. For more information on how the virus is affecting town operations, please visit the Flower Mound COVID-19 webpage.